Next one.
Yes, sir.
Hmm.
Sir, my top anesthesia information management system. Definition. AIMS is a software product that generates the medical record for an anesthesia encounter, including pre-operative, intraoperative, and post-operative documentation. AIMS may be independent applications or modules in an integrated electronic health record. It using computers to store and analyze the data, and easy way to analyze the morbidity, mortality, and any risk of anesthesia. Anesthesia record. The anesthesia record was first conceived over 100 years ago by Dr. Harvey Cushing as a neurosurgeon and Dr. Codman. Serial measurements of vital signs and list of medications administered during the course of the anesthetic. The present anesthesia document in the form of a timeline. It includes basic physiologic measurements like blood pressure, heart rate, respiratory rate, cardiac rhythm, ETCO2, pulse oximetry, how much fluid be given, what fluid be given, and ventilatory parameters, how much blood loss, and invasive monitoring and urine output, and post-operative documentation also there. Evolution of documentation. For years, the major mode of documentation was via paper. Paper sorting makes it difficult to create an accurate record because it does not provide continuous sampling of the data. First anesthesia record keepers were developed in the late 1970s or 1980s, given the need for comprehensive intraoperative monitoring and maintaining and improving the patient safety outcomes. Perioperative documentation in action. AIMS provides for the preservation and the documentation of reliable data, which is the foundation for making point of care. It allows documentation a variety of data like administered medications, while patient positioning, and fluids and blood products, clinical events such as in the induction, billing, regulatory guidelines, invasive lines placed, and TOF counts. It may also provide information about the anesthesia team like difficult airway, adverse reaction to drugs, and risk stratification. Patient risk stratification is the key aspect of anesthesia information management system, which can be determined using modified Lee Goldman index. AIMS facilitates the continuous recording of anesthesia data since it will be used in the real time during a case. It allows post-operative documentation in recovery and units like post-anesthesia care unit and HICU. It also allows during dose calculation and based on the patient's age, weight, and renal function. Key function and requirements are key software function, key technical requirement. That is workstation function, data storage, data capture, and special situation like any emergency cases. Advantages of AIMS are patient safety and quality of care. Recommendation by Anesthesia Patient Safety Foundation and documentation, cost, operations management, and clinical research. It also allows more effective staffing scheduling, lower anesthetic drug prices, improved hospital coding, and better billing captures. It supports clinical decision support like administrative process, evidence-based recommendations, multi-center study process, and facilitate further research. It also protects the legal protection. It can assist in court because the data presented is more accurate and support anesthesiologist clinical judgments. Administration and organization of the anesthesia department. It gives precise information about operating time, surgery duration, departmental guidelines, and feedback suggestion. It is quite cost effective and economical also. Drawbacks are high expense installation and maintenance, medico-legal issues, and anesthetics inattention, system ability, security, network issues, and software, hardware demonstration. That's also.
This particular terminology, anesthesia information management system, nothing but knowing all about the patient from the pre-anesthetic to the post-operative time. So whatever information you know, it has to be documented completely so that it can be utilized for the welfare of the patient as well as for improving our knowledge. For example, you give a spinal for a cesarean section. How soon after giving the spinal, the patient develops a hypotension? If you are you maintaining your records in your OT? Do you have the habit of recording your patient vitals in the OT? Do you have the chart which you are
Yes.
filling up? Isn't it?
Operative chart is there, sir.
You are maintaining the chart. Is it
We are not
properly maintained?
maintaining, sir, but patients, we are not maintaining, sir.
You are not maintaining. Supposing you do a case, don't you maintain the anesthesia chart? What was the pre-induction BP, pulse rate, saturation, how much fall happens after induction or after spinal?
We'll maintain, sir.
You maintain it. Every 5 to 10 minutes you are supposed to record the patient's vitals in a chart with a graphical display is there. Are you not doing that in your OPs?
Yes, sir. We have that chart, sir. With the patient, we will send it, sir. But for our purpose, we are not maintaining.
No, you don't. You just look at the monitor and keep it in your mind. You don't make a
No,
document.
no, sir. We will document the chart in the chart only, sir.
That's what I'm asking. If you are documenting, how often you want to monitor the pulse and puff? Supposing you do a TKR in a 70-year-old patient, how often, at what interval do you monitor the pulse and BP?
Every 5 to
1 to 1.5 minutes.
Every 5 to 10 minutes you are supposed to maintain, isn't it? And make a note of that and make a chart so that you know whether the patient's BP has been stable or whether there was an acute drop in BP which was supported either with fluids or ephedrine or phenylephrine. And what was the response? Did it come up again? Was there a drop? So all that can be identified by properly maintaining a record. Isn't it? That was done manually. But the modern thing that is happening is this documentation of the patient's parameters or the drug dosage that you are giving, they are all electronically recorded. It's called electronic health record, EHR. So to this particular thing, when all these things are done, it takes away the strain on the anesthetist to manually do that, mark it and do that. And the second thing is you cannot hook up. For example, supposing you do a spinal, cesarean under spinal, and there is an acute drop in BP and patient becomes restless, you give ephedrine and then try to correct it. If you have not documented, it will go unnoticed. Patient will go and tell the relatives, after that, I was in struggle. After some time, it became all right. Okay? So, as a learner, if you don't document it, you won't know that such things can happen. And you will not improve your next time anesthesia. You will know how to adjust the dose, you will know how to give the fluids and avoid this sort of acute hypotension in a patient by properly adjusting your medications and your fluids. Okay? So that makes your training and your experience improve by proper documentation. This is another important thing of anesthesia information management system. Okay? So, and preoperatively, if all these things are documented for a, like example is you have a patient with a difficult airway and you know that it is going to be a challenging case for intubation. Then what is the first thing you will do in the OT?
Arrange the difficult intubation.
You will arrange for a difficult intubation cart. You will immediately ask some senior help to be around so that you can do the best for the patient without going in or producing a morbidity and complication, isn't it? So this is the importance of this anesthesia information. If all these things are already given to you, then even if you are, as I said, if you have not seen the patient earlier and it is documented that anticipated difficult airway, then it will immediately strike you that you have to be prepared with a difficult airway cart and experienced help and all those things. So this is the major important thing that is being done for using this anesthesia information management system. It is nothing but what was manually recorded. And as you said, the first person to introduce this concept of monitoring the vitals of the patient is none other than the neurosurgeon Harvey Cushing. Okay? So when he did his neurosurgical procedures, he asked a nurse to one nurse will be allotted to just simply monitor the pulse and BP and note it down in the chart every 5 minutes. Okay, and at the end of the procedure, he used to look at that and see when the BP shot up, at what level of surgery the BP dropped, so that he would interpret at what particular stimulation caused the hypertension or the decrease in BP, and he was able to modify his surgical techniques also. So what he wanted to do, document for his surgical efficiency and results, that has become very important to safeguard the patients also from any complications. So that is the main idea of doing this anesthesia information management system. I will just show you the thing that is required to write. So this has evolved from a simple automated record keeping, which is nothing but the record keeping in a select few institutions to widely adopted sophisticated hardware and software integrated hospital electronic health record system. A document of patient's entire perioperative experience. So this is the main thing of anesthesia information management. It gives you the patient's entire, even though this word is given as experience, it is the information about the patient from the preoperative to intraoperative and postoperative time. This anesthesia information of the patient helps you to manage the patient. So that is the two parts of that. This concept gives the information about the patient, his preoperative condition, how his intraoperative behavior, what are all the post-op problems or the behavior of the patient in the post-op phase. All the information is given to you. Using this information, you can manage the patient much better, and the system that is used is basically electronic nowadays. That is, you are using a hardware and a software to manage that. So that is the most important definition of anesthesia information. Three parts are there. One is you know the entire history, behavior, and the details of the patient. Based on that, you can plan your management, and this management is done instead of manually writing and keeping volumes and volumes of papers. You do it using the electronic gadgets. So that is the most important thing about anesthesia information management system. And it has also helped in the administration by billing the research, clinical benefits, and the challenges are, it also helps to improve your management of the patient by going through the records and then having a discussion or a debate on how to manage critical cases. So it also helps in improving the standards of care of the patient. Now coming to the history of this anesthesia documentation of patient information, it started with Dr. Harvey Cushing and Codman, and they used it in the paper documentation of patients' physiological status. As I told you, one nurse was separately allotted to note down the vitals of the patient during 1890s and 1900s itself. But it was the electronic component came once the computers started coming into daily usage. Then people started using these electronic devices to capture, store, retrieve, and formatting perioperative data. That has happened in the 70s and 80s when computers came into regular use. And the first one was Duke Automatic Monitoring Equipment System, developed in 1980s as the first system to have an interface directly with clinical monitors to capture patient physiological data. So this equipment was attached to the monitor. I am going to show you the picture of this particular gadget which can be attached to your anesthesia machine and interfaced with the regular monitors that you use, which will store all the information that is seen in the regular parameter monitor that we use. So the subsequent system evolved a sophistication from simple anesthesia record keeping to going through using software that itself will give some solutions for you, so that the functionality across entire preoperative experience is made into anesthesia information management system was originated. So just from the documentation of vitals during the intraoperative period, because of the hardware and software of computer system is available, by interfacing it with your preoperative records as well as the intraoperative monitors and in the postoperative period, the term anesthesia information management system was coined or started being used. And that is what I told you is there are three components. One is all the details about the patient. Second is how the management was done and what are all the scopes for improvement. And the systems is usage of a software and hardware. So once you understand that, I go back to show you a picture which was used during my PG days when I went for my PG in 1976. This is the record that we used to use. Can you tell me the name of this, what is being shown here? If you go through the picture, you will have some idea about what is being shown here.
So this is one
labor
single
monitoring
paper.
chart.
Single paper?
Single paper measurements reading document.
See, it is even here. What is this written here?
Sir, anesthesia.
Anesthesia record. Okay. Does it have any name of the person who invented or who popularized this? This is called Noseworthy anesthesia record card. It is a thick, thin cardboard like. It's not a simple paper. It is a thick yellow card. So it is called the anesthesia record card, and it had both sides. It has been there. The front side you will have all these details about what is the preoperative physical status, preoperative complications, and the technique of used for ventilation and during anesthesia. What are the induction agents? How much dose, what time? Everything is given here, and this is the way we used to record. And the pre-op diagnosis operation notes, you can see gastrocolic fistula for closure, 5 months abdominal pain, vomiting, 3 weeks diarrhea and food intolerance, flatulence, etc., like that, and details of preoperative complications and previous anesthetic history. Everything has been noted as early as 1960s and 70s. And this is the intraoperative monitoring. And you always put the time. Starting time is 10 a.m. and goes on till 4 p.m. And these are all the BP recordings. You can see systolic is marked by a downward arrow and diastolic is by an upward arrow, and they are connected. They are monitoring every 10 minutes or 15 minutes. You can make the time, and what are all the drugs that have been administered, how much of inhalation agents given, and all these things. And here you have find a symbols, chemical symbol C3H6. What drug has been used? What is
Isopropane.
C3H6? Huh?
Isopropane.
Can anyone tell me that?
Isopropane.
Cyclopropane. It is cyclopropane. C3H6 is cyclopropane. Okay. So that is the volatile agent that has been used, and they have, see how beautifully he has written all the steps of surgery: intubation, closure of stomach, jejunum contraction, closure of transmesocolon, closing peritoneum. Like that, he has made down the entire steps of surgery, and they have used to and fro. This is the closed ABS. What does that mean? That is technique type of apparatus used is closed ABS, to and fro. What does that mean? The closed ventilation, closed circuit, which is used in the form of water's to and fro canister. Okay, absorber with the calcium. This ABS stands for carbon dioxide absorption. With the to and fro water's canister, they have used cyclopropane was the common agent that was used for cases like with the hemodynamic instability. This was supposed to be the wonder drug that they used, and they have given whether blood is given or not blood off. Everything, every detail has been there, but all these things have to be done manually. Okay, so this is the front and back of filled up card, and if you see an empty card, it will be like that. You can see Nagaswamy anesthesia record cards, third edition. So this is how the front of that looks, and this is the back portion of that before without any filling. And later on, they have given columns to finally, when you finish the case, you have to write here how much of morphine was given, how much of relaxant given, what is the induction agent total dosage given. So all the drugs that you give, you have to chart out and write the total. And so this is the record that has been used until computers took over. This was the method of monitoring the patient. Okay? And this is the chart where we used giving all the details. So he was Nagaswamy Michael. He was the doctor who popularized this particular type of anesthesia. He was the honorary anesthetist to Westminster Hospital, St. Thomas Hospital in London. He is a UK-based anesthetist who devised or designed this particular record. Now from here we go to currently used aims used as the pre-operative, intraoperative and post-operative cases, including pregnant patient, labor analgesia documentation, obstetric anesthesia, acute pain. For everything we have documentation. So what is an aims? It is a commonly composed of either standalone software product or an anesthesia module, which can be incorporated with the electronic health record. And it is mostly using the software nowadays. And this is a little more detailed about how these softwares are being used. And the hardware component of this is a computer workstation and a mounting equipment or a mobile wheel cover, which can be used along with the anesthesia machine. These are all little more details about the hardware and the compatible physiological device interface. And I think I have to emphasize all these things. So a successful AIMS implementation service requires not only an appropriate hardware and software nowadays, but also a minimum investment of time and peopleware, because many people are still wary about using this. They don't want to use this because one reason I find it is anything which is going not to your liking. For example, a hypertension, which you may not like to happen, that will also be recorded and documented. So you have to be doubly careful that you keep the patient vitals very stably during the management, so that whatever mistakes or unexpected turns have happened will all be documented. Whereas if you are going to do it manually, you can skip one or two documentation of the low BP and all this thing and show the patient as being very stable throughout the procedure. And that sort of cooking up cannot be done with this particular thing. That is the reason why people are little hesitant to use this, because we don't want to get into trouble by having a particular complication having been documented during the conduct of anesthesia. So the core function of AIM remains generation of an electronic anesthesia record that captures data in automatic fashion from devices such as patient monitors and anesthesia machine, and use it to sometimes there is facility also to manually document it. That also can be done. So what are all the things that you can document is administration of medication, fluids and blood, clinical events such as anesthesia induction, patient positioning, lines placed, required documentation for billing and regulatory guidelines, and the anesthesia start and stop time. This is very important because in private nursing homes, the duration of entire starting from anesthesia to shifting out the patient, they charge this as OT time, and the charges are based on the duration that the surgeon that is take to complete the procedure. So it will increase if the time duration gets prolonged. And the other relevant data that are not captured in automatic patient, just like train of four counts which are used for monitoring the neuromuscular blockade, also can be incorporated manually. And these are all little more details about that. And you can get all the allergies and medications that are being used, that also can be incorporated in the aims. So it is more or less like a total information on the patient, which is documented automatically without a manual interference. And at times, if you are using a special monitor which is not used along with the regular monitoring, that can be automatically manually included in that by typing it. And the benefits are, you have abandoned paper records. Nowadays, we want green air, so we don't want too much of paperwork, and everything is going into the soft copy. And the unacceptable cost of installation is the one drawback about this, which is not allowing people to use it on a regular basis. And you cannot do any distraction of the anesthesia providers because it is automatically done. It is uh, not going to interfere with the anesthetist concentration on the patient. And but some medico-legal concerns are there, and there is some resistance to change because majority of the anesthetists and doctors are still in the era of manually documenting, writing case sheet notes and all those things. And this can positive returns in four areas that can happen by using AIMS is efficient shaft scheduling, resulting in decreased staffing costs, decreased anesthesia medication costs, improved charge and billing capture, and increased hospital reimbursement. And the minimal impact on vigilance and accuracy of practitioners' recall of patient variables. So you may not remember what happened. For example, if some calamity happens during conduct of anesthesia and there is an inquiry after 2 months, you may not remember exactly what happened at that particular time. But if you go through the records, that will immediately show that there was an acute hypotension for so many minutes, and there was some delay in resuscitating the patient after cardiac arrest. All that can be permanently recorded by the using this software and hardware systems, which you cannot remember in case it has to be recalled, and then some investigation has to be done in such situation. So aims-based clinical decision support. So if you have this habit of recording all the patient's behavior, that can be used to improve the administration as well as the improving the patient's safety by adhering to or creating protocols and guidelines so that the complication is not allowed to recur or re-happen again. So that is the advantage, and the variety of alarms, alerts, reminders will help to modify the anesthesia practitioner. They can alter their perioperative processes, correcting the errors. So all these things can be done by properly, and you can find out what are the common complications after particular surgery. For example, you do a Whipple's procedure in about 50 patients. You can identify what are all the common intraoperative and postoperative problems that you faced by going through this record. So that is a clinical decision support can be modified by using this recording system. And the secondary uses of AIMS data is you can do clinical research also by utilizing this data, collaborative process across many institutions. If all the hospitals are going to use this, you can get the data from the other hospital and compare your data with that particular for a particular surgery and see what is the improvement that you can be doing it. And this is the picture I just want to show you. You can see here, this is your regular monitor which you are using, and this is the AIMS software hardware this thing. And this is the monitor screen where you can see the parameters getting transferred from the monitor and right from the fresh gas flow you are using to concentration of the volatile that you are using, and you can see there is a keypad. So if you want to manually enter something, you can always type and incorporate and include the time, and that will also be included. So automatic recording will be there. Facility for manually entering the details are there, along with all the information from the machine to the vitals of the patient. And you can also the software will help you to say how much of propofol you gave, what is the total dose if you are using a Tiva infusion, what is the remifentanil dose, what is the relaxant totally you have given, what is the reversal, everything can be included. What was the patient starting BP, what is the end BP, what was the patient temperature before starting, what is the ambient room temperature, whether patient went in for hypothermia, whether you used a warmer, all these things can be completely given. So you get the entire information about this in this small piece of equipment, which can be incorporated, and that will help. This is the way the recording is done. So these are all the parameters that can be. This chart you can always download at any time, and you can go through, analyze each and everything, and that will help you to improve, form the protocol, as well as do any research that you want, you can do that. So these are all the advantages of that particular AIMS system. I hope I was able to give you some clear thought about what is AIMS and its uses, and how it can be utilized. Okay?
Yes, sir.